if I told you that you could start making powerful changes to your blood sugar within days? That within weeks you could begin to see real progress, and within months you could notice improvements not just in your blood sugar but in your overall health, your energy, your sleep, even your sense of control over your body. It's really incredible what's possible when you take the right steps, and I've seen it happen time and time again with the people I've worked with. But here's the thing, while these changes are exciting, they need to be approached with care, especially if you're taking medications or have complications to diabetes like retinopathy. Rapid drops in blood sugar can sometimes cause unintended problems, and it's important to understand the full picture before diving in. That's why this video is important. I'll be sharing my personal experience and observations from helping hundreds of people reverse their diabetes and take back control of their health. I'm Dr. Nerys Frater, an NHS GP and founder of the Lifestyle Clinic. Over the years, I've worked with hundreds of people who've reversed their diabetes and taken back control of their health. My approach is simple. I help you work with your body and not against it, and I guide you through two essential phases of this journey. The first phase is all about reversing the diabetes. This is when we focus on stabilising blood sugar and addressing the root cause. The second phase is about keeping diabetes in remission or preventing relapse, which actually takes a different approach. We focus much more on mindset and long-term habits. Both are equally important, and today I'm going to show you how they're going to fit into your journey. So let's start by talking about the timeline. One of the most common questions I get is, how long will it take for me to reverse my diabetes? And the honest answer is that it depends. Every person's journey is unique, and there are several factors that influence how quickly you'll see results. And these are, the number one, the severity of your diabetes. If your blood sugar levels have been high for a long time, or if you've developed complications, it may take longer to see significant changes. But don't let that discourage you, because it's never too late to start improving your health. Number two is consistency and habits. Small, consistent changes add up over time. The more consistent you are with your diet, your movement, and your mindset shifts, the faster you'll see progress. It isn't actually about being perfect, it's about showing up for yourself every day. Number three is your starting point. So some people may see improvements within weeks, while others may take a few months to notice changes. It depends on where you're starting from, and that's okay. The key is to focus on your own journey and not compare yourself to others. And the important thing is to remember is that this isn't actually a race. It's about working with your body and giving it the time it needs to heal. And healing happens in stages, which brings me to the typical milestones you can expect. So when it comes to reversing diabetes, I found that the journey can be broken down into three distinct phases. Each phase has a specific goal, and together they create a roadmap for long-term success. So let me walk you through these phases. The first phase is stabilising the ship, as how I like to think about it. The first phase is all about getting control quick. And this is where we focus on the most impactful changes to regain control over your blood sugar levels. The goal here is to stop those rapid highs and lows that can leave you feeling unwell and exhausted. The incredible thing about this phase is that the effects can often be seen within days. You might notice steadier energy, fewer cravings, and improvement in your blood sugar reading. But this is also the phase where caution is critical, especially if you're taking medications like insulin, gliclazide or glimepiride, or have complications of diabetes such as retinopathy. Do not do this without medical supervision. Rapid drops in blood sugar can cause unintended problems. So it's important to approach this phase with care and ideally with professional guidance. This is why I emphasise the importance of working with somebody who understands the medical side of diabetes management, like we do in our blood sugar mastery programme. So once that phase is done, phase two is about normalising the blood sugar and addressing the root cause of the diabetes. So once that ship is stabilised, we move into phase two. This is where the real work begins. It's not just about managing symptoms anymore, it's about understanding and tackling the underlying factors that led to diabetes in the first place, so like insulin resistance or chronic inflammation. This phase often takes weeks to months, but it's where you'll start to see deeper, more sustained improvements, not just in your blood sugar, but in your overall health. What happens here is it becomes a healing process for your pancreas in particular. We start using food as medicine and learn about how you can work with your body and not against it. And then the third phase, which is all about the psychology and mindset. This is the phase that most people overlook, but it's absolutely critical. Psychology and mindset is when we focus on creating the mental and emotional tools that you need to maintain your progress and prevent relapses for the long term. It's the work that people often think they can skip, but when they do, they find themselves stuck in a start-stop cycle, making progress, falling off track, going round and round. This phase is about building resilience and creating a sustainable lifestyle that feels natural and enjoyable and not restrictive. We work on shifting your mindset from an all or nothing one that embraces progress over perfection. I've been low carb for 7 years now, and this is because I have tackled my bad habits, my beliefs, my routines that were sabotaging my progress. So this is less about willpower actually, and it's more about skill, a skill that unfortunately none of us have ever been taught, and the vast majority of diets completely ignore. So if you think that you can reverse diabetes with a meal plan, then I'm afraid you are mistaken. Yes, you can get to phase 1 or 2, but if you're going to reverse diabetes, then you really need to keep out of it as long as possible. So let's talk about something that trips up so many people, the idea of perfection. It's easy to think that if you slip up, if you eat something you shouldn't, or miss a workout, you've failed. But honestly, that could be further from the truth. Progress, not perfection, is what matters. Every small change you make, every healthy choice you prioritise is a step forward, and those steps add up. I tell my clients to think of their journey like climbing a mountain. Some days you'll move quickly and feel like you're making huge progress. Other days you might feel like you're barely moving at all. But as long as you keep going, you are getting closer to the summit. And here's the thing, rushing the progress can actually and does backfire. When you try to do too much too quick, it's easy to burn out. You might find yourself overwhelmed, frustrated, or even tempted to give up. That's why it's so important to take it one step at a time. Focus on what's realistic and celebrate the small wins along the way. So these 3 phases, the stabilising the ship, the normalising the blood sugar, and focusing on mindset, are the foundations of how I've helped people over the years reverse their diabetes and keep it in remission. Each phase builds on the one before it, creating a comprehensive step-by-step approach that's both effective and sustainable. So if this sounds like something you want to learn more about, then please add yourself to my mailing list. Download free guides, join the upcoming free events, and make sure you learn as much as you can.